Live at 5, lawmakers trying to give more resources to expectant mothers here in Georgia.
But their bills are not likely to go anywhere without a little push. Atlanta News First reporter Abby Casores joins us live at the state capitol. And Abby, they tell you without action, we are putting more Georgia women and their babies at risk.
Yeah, that's right. Georgia is one of the worst states for ensuring the health of both mother and baby before and after birth. Lawmakers and advocates here at the state capitol today saying that something needs to be done because these people are more than just numbers on a report. These are mothers who never made it home and babies who were hoped and prayed for.
Every year we get the data. Every year, everyone is concerned, but yet decades go by and there's no change.
Dr. Cecil Bennett practices family medicine in Coweta County. He has people driving from surrounding counties to see him. According to the Georgia Board of Healthcare Workforce, more than a third of Georgia counties have no pediatric physicians. More than half have no OBGYNs.
There really has to be a commitment by the state to go into underserved areas and make sure that women have the same access to care as if they were in a major city.
A March of Dimes report found the lack of health care is putting babies and their mothers at risk. Over the last decade, more babies are dying before their first birthday, and more women, especially black women, are dying from complications from pregnancy, childbirth.
I'm grateful to be alive because there's so many stories that I hear, unfortunately.
Regina Davis Moss says she got dangerously close to becoming a statistic.
My blood pressure spiked. My son went into fetal duress. I was rushed into an emergency C-section. I do remember the neonatologist saying to me, listen to me, we're going to move really quickly. I'm going to give you 10 seconds to hold your baby, and then I have to take you away and the baby away.
She says Georgia lawmakers have a moral obligation to act. State Democrats pushing a slew of bills, a licensure program for midwives, mobile health clinics for rural Georgia, and reinstating a state maternal mortality review board. The governor disbanded after news leaked to the press regarding 2 Georgia women's deaths ruled preventable.
A preventable death is murder.
State Representative Derek Jackson says Republicans can't ignore the statistics, pushing a bill to fully expand Medicaid under the Affordable Care Act, which currently has 4 Republican sponsors.
We have to turn the corner on this and say, Governor Kemp, let's move this bill forward. It doesn't matter who gets the credit. It's not about Democrat or Republican.
Republicans announcing their health care priorities last month, and while we haven't seen any new bills dropping related to maternal mortality from the Republicans, they have included millions of dollars for rural hospitals as well as other initiatives in rural areas. Live at the state capitol, Abby Casores, Atlanta News First.